Hello, I'm Crystal Stevens, and I'm going to talk to you today about assessing human trafficking in primary care. I am a nurse practitioner and recently have completed my DNP project with a focus in human trafficking. Human trafficking is defined as the recruitment and/or holding or moving of vulnerable persons by means of force or threat for the purpose of exploitation. Some statistics on human trafficking related to medical care include that 87.8% of trafficked females in the U.S. have been evaluated by medical professionals during their captivity. Areas where these patients are seen are emergency departments, health departments, urgent care, and primary care. Now that's a huge number, 87.8%. And I'm sure most of you that have any kind of background or understanding of human trafficking are probably not surprised by patients being seen in emergency departments. Maybe a little more surprised to know that these patients have been seen and are seen in urgent care and primary care settings. It's estimated that 35.8 million people worldwide are currently enslaved. Human trafficking is believed to fall just below drugs and arms smuggling in criminal activities around the world. Now, some of you might be thinking this is something that happens in some of those other countries. Well, human trafficking is rising in Kansas. Wichita and Kansas City are recognized as major originating cities. The rural areas of western Kansas are potential sites for human trafficking for forced labor in agriculture and food processing. Human trafficking reports from victim service agencies indicates that trafficking is occurring in mid-level communities across our state. In the literature, when I went to complete a literature review, what I found was human trafficking screening is being done in some areas, but it is focused in acute care and emergency department environments. Well, from research that I did, I saw that these patients are saying, we're not just being seen in emergency departments, we're being seen throughout the healthcare system, including things as dental clinics. So it's important that we are screening in areas other than emergency room settings. Anyone can be at risk for becoming a victim of human trafficking, but women and children are the most vulnerable. Other factors identified as risk for becoming a victim of human trafficking include a lack of education, a history of abuse or violence, family instability, being disabled or marginalized, or being stigmatized because of gender, culture, or ethnic background. Extreme poverty is noted as the highest push factor, increasing a person's risk of becoming a victim of human trafficking. Victims of human trafficking suffer with multiple serious physical and psychological health concerns. Physical effects include physical injury with pain, loss of function, scarring, sexually transmitted infections including HIV and AIDS, malnutrition, dehydration, untreated chronic medical issues, chronic pain, and dental complications. Other physical health concerns include headaches, fatigue, back pain, and pelvic pain. Emotional and psychological health consequences of human trafficking include post-traumatic stress disorder or PTSD, anxiety, depression, aggression, major depression, sleep disorders, and suicidal ideations. So after completing my literature review and learning a little bit more about human trafficking, seeing where victims were being seen, as well as seeing that there were areas where we were falling short in our screening process, I decided to focus my DNP project on assessing for human trafficking in primary care. I liked this quote. We really only have two choices, do nothing or do something. So my something was to look into the possibility of screening in a primary care environment. So the objectives of my project were to pilot the human trafficking medical assessment tool in local safety net clinics, to identify strengths and weaknesses of screening tools used within the primary care environment, and then to recommend screening guidelines for safety net clinics across Kansas. Now, just to take a minute to talk about human trafficking screening tools. There are currently 15 screening tools developed to screen for human trafficking. Of those screening tools, there are only 2 that were designed specifically for healthcare providers. The Polaris Project medical assessment tool is viewed as the best option for screening in healthcare environments. So that is the tool that was modified for use in this project. Here is what the human trafficking medical assessment tool looks like. It starts out with signs to look for during the medical encounter. So if a patient is not allowed to speak for themselves, patient claims to be visiting or unsure of where he or she is, patient shows signs of abuse, medical neglect, multiple sexually transmitted infections or torture, students under the age of 18 engaging in sex or trading sex, or just multiple inconsistencies in the story. So if a patient has any of those, so 1 or more, then we move to step 2, where the person is asked these questions. So if a patient answers no to all of these questions, then it's considered a negative screen for human trafficking. If a patient answers yes to 1 or more, then we move down to step 3. So really this is the human trafficking medical assessment tool for the Topeka area, with resources in the Topeka area. But I have also developed one that had resources for the Manhattan area, which was where one of my clinics were. And when I was thinking I might get to do this in Lawrence as well, I was looking at adding resources there. So step 1 and step 2 are consistent no matter where you are, where your final step 3 is going to be modified based on what agencies are available, what resources you have to offer to victims. As I looked for clinics to participate in this project, I was really trying to get a large enough sample to be able to see if the human trafficking medical assessment tool would be viable in a primary care environment. So of the 4 safety net clinics I reached out to, 3 agreed to participate. 1 was a rather large clinic. The other 2 were a little smaller in scale. The second large clinic that I approached was unable to take on this project at that time because of some managerial changes. So once the 3 agencies agreed, I went out to each agency and provided staff training on human trafficking statistics, risk factors for human trafficking, health consequences, as well as giving them training on the human trafficking medical assessment tool that I just showed you on the previous slide. Once all the training was done, the human trafficking medical assessment tool was piloted from June 1st through September 14th of 2018. So from June 1st to September 14th, 4,226 client encounters happened at these 3 safety net clinics. Of those 4,226 clients, 1,438 of them were screened using the human trafficking medical assessment tool. 8 clients, again this was over the 3 clinics, exhibited red flags as noted in step 1 of the screening tool. Of those 8 clients, 1 client screened positive from the questions asked in step 2. So they had one what was considered a positive screen for human trafficking. At the completion of the pilot project, I scheduled a time to meet with staff at each of the clinics to have some follow-up dialogue about what went well, what did not go well, and what they felt could be done to improve the process. So, what went well? Staff at each agency felt that the use of the human trafficking medical assessment tool within the clinic did go well and thought it was functional in the primary care environment. Staff also reported that they felt that screening for human trafficking helped increase their communication about other social aspects of clients' lives that were not being discussed prior to the initiation of this project. Overall, nursing staff and providers were positive about the use of the human trafficking medical assessment tool in the primary care environment. The what did not go well and what could be done to improve, really, there was one key thing brought up by staff, and that was that this medical assessment tool, human trafficking medical assessment tool, needed to be integrated within the EHR. So of the 3 agencies that piloted this human trafficking medical assessment tool, only one was able to put it into their EHR. So the other 2 felt that it was really cumbersome to have this extra piece of paper that had to be brought in to screen patients and to then scan into the EHR for it to be part of the record. So they said if this was something that they were going to do for life, that it really needed to be included in the EHR. So overall, the human trafficking medical assessment tool was well received by providers and staff. It was found to be functional in the primary care environment. Some of the limitations to this project were a short implementation period, and that was really so that this project could be evaluated, written up, and graduate that same semester. It also focused on safety net clinics. So a safety net clinic looks a little different and sometimes functions a little bit different than your traditional primary care setting. So if we were going to try to generalize that this human trafficking medical assessment tool was usable in primary care, it really needs further research looking at the implementation into traditional primary care settings. Lastly, I'm sorry that this presentation could not be done in person where you can ask questions, but please feel free to reach out to me if you have any questions about this project. I would be happy to talk with you.